Hello. Welcome to chilly, chilly cold Chicago. This is the second episode of Dr. Jeff Talks About Sex and Intimacy, and I am so honored and privileged that you came to share this space with us this evening to learn more, to grow in your knowledge on sexual health. It is going to be an amazing evening for sure. I'd like everyone to know that everyone is welcome in this space, regardless of your sexual orientation, regardless of your gender identity, or your relationship style. All are welcome here. It is really cold in Chicago. If you're trying to figure out how to find us, you can find us on social media, all these different ways. And so don't forget, if you need to find us, we're on YouTube. You can watch us later. You can follow us, like us. We would love that. Also, you can go on the website. On the website, you're going to see all of the episodes that are coming up, and we have so many amazing guests, including our guest tonight, that I'm very excited about. But we have great people, and you can look at the calendar and see what's next and what's coming up. I don't know what it's like where you are, but let me just describe the wicked, frigid weather here in Chicago. And I understand it's equally cold in Philly, but it was so cold that when I took my little compost from my house over to the compost place where we deposit it, it has a little lock. It is so cold here that they recommended, and I did, thank God, I brought this little warm rag in my pocket that I put around the lock so it could thaw, and I could actually move the numbers to open the lock to dump my compost here in Chicago because it's so flippin' cold here. So, but thank heaven my wife had some wonderful, delicious, savory split pea soup. Love a split pea soup in the winter. So anyway, hopefully that warms you up a little and gets you ready. Have you seen the latest Gallup poll? Who do you think is the most trusted professional for 23 years in a row? Who do you think the most trusted professional is in the world? Well, that would be nurses. And so for 23 years in a row, nurses. I'd like to give a shout out to the amazing nurses. And you'll see oftentimes I have nurses on this show. After you get the diagnosis, after you deal with whatever you're dealing with, you turn to the nurse, and that's the person who you say, how do I do this? How do I navigate my way through this? And that's nurses love to put patients at the center of care. They educate patients. They're advocates for patients. It's all about you. And so even though our guest tonight and I, we have PhDs, we're advanced practice nurses, we run our own clinics, we can prescribe, but we still understand and know the value of education and advocacy. And for us, it's all about you. So my mission's pretty simple with this podcast. My only goal with this podcast is to empower and enlighten you with fact-based, accurate information so that you can improve sexual health, so that you can deepen intimacy in your life, so that you can build more fulfilling, wonderful relationships in your life. I want more of that. I don't know about you. And I hope that the information we give you will help you to move along with that. Tonight, as we dive into our presentation and conversation, I want to remind you of something really important that I don't want you to forget, because it's a lot of stuff to learn, a lot of things to hear. You are so much more than the challenges that have showed up in your life today, in the last week, this year. You are so much more than the trauma that you have experienced in your life. You are so much more than the health issues and the diseases that you've been diagnosed with. Those things do not define you. You are so much more. So you are a person of incredible inherent value. So this journey is about really strengthening, really building up your resilience and strength. building greater connection with others and joy. I am just so excited this evening to introduce you to our guest. She is amazing. Dr. Susan Kellogg-Spadt has been a friend of mine and a colleague for many, many years. And we used to write a column together called Intimacy Issues. It was a lot of fun, and we really enjoyed that. Dr. Susan Kellogg-Spadt actually wrote the chapter in my latest book, The Core Curriculum for Urologic Nursing. She wrote the chapter on female sexual dysfunction. She is the director of female sexual medicine for the Center for Pelvic Medicine there in Philadelphia. She has several appointments as a professor at Drexel and Rutgers College of Medicine, at Widener University, at University of Pennsylvania. She is also a certified sexuality counselor. But here's the thing. She is literally the best in her field. Honestly, if I have any questions at all about female sexual health, she is the person that I turn to, and she is my mentor and colleague that I look at as the greatest expert in this area. She has achieved so many things as an author, as a presenter, as a clinician in this field. She's written a lot of things. It's just amazing. But besides all that, she has an amazing family, has raised 2 children who are married and doing well, and she's just an awesome human being. And I am so privileged to call her friend, and so happy and excited to have her join us now to share her expertise. Welcome, 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 my
Thrilled
friend.
to be here. Thrilled to be here. Talk about our favorite subject, which is sexuality and intimacy. So really excited, but really cold too. You know, look at the cold as an opportunity to cuddle. That's what you got.
I love that. Look at the
Yes.
cold as an opportunity to cuddle. It's perfect. And it
Absolutely.
is so flippin' cold. Well, I am so glad. I am
Yeah.
so glad to have you here this evening. You have so many great things to share. I've seen your slides, and I can't wait for everybody to learn from you. So if you're ready, let's hop right in and
Go for it. Let's go for it. All right. So tonight we're going to talk about empowering women through information. And what I'm really going to do is give you guys guys and girls, everybody, lots of information about what's new in for women. You know, I hear all the time from my patients. I have a clinic just like Jeff does. And I hear all the time from my patients, you know, there's all this stuff for men. They have Viagra, they have Cialis, they have da-da-da-da-da-da. What is there for women? Well, most people think that there's not much for women, but you're going to be a little surprised tonight because I'm going to take you on a quick little vision board of what is available to enhance women's sexual wellness and what you as a consumer can talk to your clinician about on your next visit if you wish to do so. So let's get going. All righty, next slide. I think we do it this way. Let's see. There we go. All right. So, you know, women are a little complicated, but I love being complicated myself. My sexual response is really the melting pot, if you will, of my physical self or my biology. So my physical health, my hormones and things that are running through my body, but also how I was brought up, my sociocultural self. I was brought up in the middle of the Midwest? What were the cultural norms there? What were the expectations of me as a person who had a female body? That's really a part of who I am, is how I was brought up. And then my psychology, am I suffering from anxiety or depression? And what is my expectation of myself in terms of sexuality and my own performance, others' performance? Who I dated, why I dated, who I married, those are all part of the psychology of female sexual response. And then last but not least is the interpersonal part. And that is my current and my past relationships. You know, sometimes we go through a relationship, they're like, oh boy, am I glad that's over. But believe it or not, all those past relationships they change us, they shape us into the person that we are today, for better or for worse. The stresses, the finances, things that are in your current relationship and that were in past relationships, that all comes in to make the person that we are as a sexual person. So it's our biology, how we were brought up, the psychology of who we are and what we're dealing with on a daily basis, and then all the past relationships and current relationships that we're involved in. So that is just how complex we really are. So why should we address female sexual function today? Because darn it, it's important. It's important to quality of life. And female sexual challenges and concerns are so common. We're going to see just how common in a minute. But it's really important that you ask questions and learn about options to optimize your own sexuality and to enrich your life from that perspective. I'm going to just kind of do that. There we go. So let's look at this is data driven, as Jeff commented. All this stuff that we're going to talk about is data driven, but this is the prevalence of sexual problems from a landmark study that was done really early in the 2000s, but still holds lots and lots of value today. So if you'll look on the left side, you'll see the ages of the patients the women that were in the study. And they were asked about the sexual problems they had with reference to their sexual desire, arousal, their ability to have an orgasm, or anything at all, any of the above. Now, notice, please, that this particular study didn't look at sexual pain, which is in and of itself can be a huge issue all across all of these age ranges. And it's about 16% of women at all age ranges have a problem with discomfort during sexual play. But in terms of desire, take a look at this. The 18 to 44-year-olds, almost 9% of women had a long-standing distressing problem with their sexual desire. It's like an 18-year-old. My goodness sake, you think that they're highly sexual. They couldn't have a problem, but yes, they can. Arousal, about just over 3%. Orgasm, just over 3%. And again, any kind of concern, about just over 10%. But in that middle range, see that 45 to 80, or I'm sorry, to 64-year-old, that middle age, if you will, the pre, peri, and postmenopausal space, that desire issue sparks up. It's about almost 12, it's just over 12%. About 7.5% of women in that age range have difficulty with arousal, 5.7% difficulty with orgasm, and then about 15% of all women in that middle range have issues that just with their sexuality in general. So please, if you fall into any of these categories or ever have, please don't feel alone. There's a whole lot of people joining you in this space. And then for women 65 and older, we actually see some of the numbers go down, interestingly enough. Now, that's sometimes because it's just not worth worrying about, or maybe they've lost their partner, or maybe they've figured out an answer to their concerns. But for 65 and older, about only 7.4% of women worry about their desire, 6% their arousal, about 5.8% worry about having an orgasm or cannot have an orgasm, and then any sexual problem at all is about 8.9%. So these overall, if you put this in a big melting pot, you're going to see about 12% of all women of all ages have concerns about their sexual performance or their sexual or have sexual issues. That's so common. So because it's so common, it's certainly worthy, I think, of a good podcast discussion like today, and also worthy of some interventions to address some of these issues. So we're going to take a look at those in just a minute. But one of the most really interesting things that we're going to try to change, I think, with this podcast, but also with specialty clinics like the one that Jeff runs and the one that I run, which really is for people with sexual concerns, is that most people with sexual concerns don't bring it up in a formal kind of way. So let's see how they seek their care. About 14% don't seek help at all. They're just like, there's probably nothing that could help me, so I'm just not even going to seek care at all. About 9.1% seek anonymous information. So that could be like hopping on the internet and staying very anonymous and seeing what can be done for my particular concern. About 41.9% seek care or seek advice informally. So that's not a healthcare provider or a knowledgeable nurse or doctor or a physical therapist, but maybe it's their banker, or maybe it's the lady at the Acme, or maybe it's their best friend. Often it's their best friend. Maybe it's Facebook. Maybe it's go on and on and on. So very informally, they decide that certain people might have a knowledge base to address their issues, and then they inform them of their concern and see what they think about it. The issue here is that it's great if people have friends and talk to friends about this, make no mistake, but sometimes those well-meaning friends or well-meaning Facebook posts or well-meaning internet sites don't have accurate knowledge, and so that it doesn't always lead a person to finding the solution to their issues. And then last but not least, the 34.5% actually talk to their healthcare provider. And that might be their primary care physician or nurse practitioner. It could be somebody in urology. It could be somebody in OBGYN. It could be their psychiatrist or psychologist or their physical therapist for that instance. But so it's a healthcare provider of some sort who has access to evidence-based information like we're presenting here. So we need more people, including you, our wonderful listener, to, if you have concerns, please bring it up with a knowledgeable healthcare provider. And if for some reason the healthcare provider that you picked is not knowledgeable, try someone else, because the information is out there and can be accessed. So let's look at some very basic pharmacologic options for women, and then we're just going to keep going and seeing what else there is. So I think everybody knows when women are in perimenopause and menopause, they can have a real problem with some vaginal dryness, and that vaginal dryness can lead to kind of that itchy feeling or scratchy feeling, or more propensity to have infections, or else just really dryness that precludes comfortable pleasure with the partner or with themselves. So local estrogen creams and tablets and rings are prescription products that provide estrogen to those sensitive tissues of the vulva, which I understand that Jeff introduced last week, the vulva being that external area, the introitus, or the opening of the very vagina, just the opening, or deep in the canal. All of those places are estrogen sensitive. So when we talk about local estrogen, we're talking about estrogen having its effect locally in the opening of the vagina or the vulva. We're not talking about systemic estrogen that goes to the brain and breasts and face and hair and nails. We're talking about just locally acting estrogen. The risk is lower when one uses local estrogen in terms of the potential dangers of estrogen. Risk is very, very low and is endorsed for women across the board, generally speaking, even if they're cancer survivors, as long as it's delivered just locally. So if that's an issue, please talk to your healthcare provider about that if you're having tremendous dryness. Now, the first kind of impact for, usually when people are dry, the first thing they use is moisturizers and lubricants. And we're going to have a whole show on here about moisturizers and lubricants. But for some women, honestly, traditional over-the-counter moisturizers and lubricants, they're just not enough. If somebody needs something more to address the moisture, the elasticity, and the vitality of the genitals. And so sometimes they do need to add local estrogen creams, tablets, or rings. And here's just some examples. I'm sure you've probably heard of estrase cream or Premarin cream, but there's also little tiny inserts called Imvexi, and there's little pills called Uvafem or Vagifem. These are all prescription products. You can talk to your healthcare provider about them if you think you would benefit from them. Now, there's some other options in this space. One is called Osphena. That is an oral tablet, and it is not an estrogen, but it's what kind of like a smart tablet. It finds estrogen receptors in the bone and uterus and vagina and labia, and it binds to those estrogen receptors. And once estrogen receptor is bound, it acts like an estrogen, even though it's not an estrogen. It doesn't ever make its way to the breast, and it actually is considered a lovely option for people who are having particularly pain, which is what it's indicated for, pain with sex, but it's not, that don't want to use estrogen at all or can't use estrogen at all for whatever reason. So this is one that it's an oral pill. It acts like an estrogen, but it's not an estrogen. It's kind of a designer pill. Another option is something called Intrarosa. This is an intravaginal inside the vagina insert, like just a little suppository, and that is made of a synthetic form of DHEA, which is dihydroepiandrosterone. Go figure that one. But anyway, this is not, you don't have to repeat that, but it's a precursor to estrogen and testosterone. And so when this is put in the vagina, it leaves it up to the vagina to make from this basic building block, make its own estrogen and or androgen, which is like testosterone. Again, this is not systemic therapy. We're still talking about local therapy just for the vagina and vulva. But this particular one gives the vagina its precursors and says to the vagina, you make what you need and nothing more. So this is a little bit of a designer thing as well. Again, prescription, very, very effective. Okay, we're going to keep talking. So you probably read about things like laser therapy for dryness and for vaginal rejuvenation. This isn't really a rejuvenation. It's not like plastic surgery or anything like that. But a laser applied inside the vagina, as you can see in this picture, is these are designed to cause tiny, tiny micropores inside the vagina, little tiny micropores. And from those micropores, that stimulates the vagina to have increased collagen and increased blood flow. It's called revascularizing the tissue. And this is about a 5-minute laser session. It's done every 6 weeks times 3. Generally, the patient doesn't need any anesthesia. It's done right in the office, and it is FDA approved as a device, not particularly for this particular intervention, but it is as a device. It's been checked. Unfortunately, this particular one is not reimbursed by any insurance. So in some places, it can be quite costly. Other places less so, but if this is something that's of interest, certainly you want to talk to a very experienced provider who is used to doing laser therapy. This particular laser, again, is a fractional carbon dioxide laser, creates tiny little micropores and causes the area to have increased blood flow and increased collagen. Many people find that makes their sexual play much more comfortable. All right, so let's talk about some newer options. So we're going to move from kind of discomfort during sexual play or dryness during sexual play to what about if you could care less about sexual play or low desire, okay? So a lot of people think, well, if I don't have any desire, it's part of menopause, it's part of being married X number of years, it's part of my depression or my anxiety diagnosis. Well, not for everyone. There are many people that have like an idiopathic or not really a cause, but they just know that they've lost that love and feeling. They just don't have any desire. So flibanserin is the trade name, or the popular name for this product is called Addyi. Addyi is a pill that was approved in 2015 for premenopausal women who complain of low desire. That's what the original 11,000 subjects in this study looked at. And then they did a sub-study that looked at postmenopausal women with low desire, and those studies are completed as well. How Addyi works is it's not hormonal. It increases brain levels of dopamine and norepinephrine, and those are two neurochemicals that increase sexual motivation. So again, we're not talking hormones this time. We're talking about increasing chemicals in the brain that increases sexual motivation. Yeah. Over 11,000 subjects were initially evaluated in the study that was presented to the FDA for FDA approval, and they found an increase in sexually satisfying events and desire and a decrease in sexual distress with use of this product called Addyi. This is one pill taken every day for at least 8 weeks. Why do I say that? Because it's not one and done. It's not like Viagra, which can be taken right before an event, about an hour before an event, and then sure enough, the erection occurs. This is something that has to be taken every day and build up over time before a woman sees that it is working. And right in the package insert, it says should be taken for 8 weeks before one decides if it's working or not. If it's not working, the package insert also says if you don't see any change at all in 8 weeks, it's probably best to discontinue the drug. So just like every drug, no one drug works for everybody. And so we know that there's about a 60% responder rate with this particular drug, which means about 60% of people who take it actually see a lovely increase in their sexual desire. And about 40%, they don't feel anything. They don't feel bad. They just don't feel any better in terms of desire. So it's important to know if you try something like this, again, prescription, talk to your healthcare provider about it, but go ahead and take it for the 8 weeks and see if it works for you. If it doesn't, sorry, you were one of the 40% non-responders. If it does, it's really a lovely return to desire. And again, no hormones on this one. Side effects include mild nausea when it's taken. It's probably best taken with food. Dizziness, fatigue, and something called somnolence, which is sleepiness. They very strongly recommend right in the package insert that it be taken at bedtime so that if you feel sleepy, you go on off to sleep. And so that you're not, being sleepy while you're driving a car or anything like that. So this is a really nice product. It's been very, very popular, and it's used by both pre and postmenopausal women. It is only reimbursed by some insurance companies. And so when it's not reimbursed by your insurance company, there is a plan that you can get Addyi off your insurance company for about $99 a month. That might seem like a lot, but for women with low desire, that's really not a lot at all to have return to that feeling of wanting to want or wanting to be active with a partner or even with yourself. Here's the efficacy results. If you look at Addyi is shown here in the pink, and the control group is shown here in the gray. And the first slide is looking at increased sexually satisfying events or more events. Their people were more sexually active. The second one is looking at their desire. Look at that, the higher level of desire with the pink versus the gray. And then the last slide is looking at distress and looking how the pink shows the distress goes down. And women that used to feel desire, natural desire, and just lose it, they feel highly distressed about that. And so you can see the distress going down as in the clinical studies to show the efficacy results of the of Addyi. Okay. Well, guess what? There's also injectable agents. So bremelanotide, trade name is Vyleesi, is an injectable agent that's a synthetic form of something called melanocyte-stimulating hormone, another pro-sexual brain chemical that has been made into this particular product. This is injected right under the skin, like an EpiPen kind of, and it works within 1 to 4 hours for a time that increases a woman's desire, and it actually has a side effect of increasing sexual arousal as well. Once again, it is not hormonal. This is not estrogen. It's not testosterone. It's not progesterone. This is melanocyte stimulating hormone. That is a hormone in the brain. It's a neurohormone, and it actually helps with female sexual desire and arousal. This thigh injection, like an EpiPen, is not painful. It feels just like a little tiny skin prick, but it's not a deep injection. It's a tiny little needle that just delivers the medicine under the skin. The side effects, like Addyi, include nausea, flushing, and headache as well. It is not particularly associated with somnolence or sleepiness. Now, unlike Addyi, remember I said that has to be taken every single day for at least 8 weeks to see if it's going to work. Well, this particular little sex pen, I guess we'll call it, or Vyleesi, is used episodically. So it's used before an event. So let's say that it's Friday and the weekend is about to begin and you are not feeling very libidinal or full of libido and you'd really like to, then you would use the Addyi about an hour or so before you want to feel that sexual desire. And so then it proceeds. All right. Now, the problem with Vyleesi, and again, not a problem, but one thing I want to really point out is that the nausea for some people can be transient and kind of no big deal, but the nausea for other people using Vyleesi is a reason for them to discontinue it because they get quite nauseated. So again, you don't know if you're going to be one of the people who has nausea from this that's very upsetting nausea, or just a little bit of an upset tummy. But it does the whole range, the whole gamut. So I would say that if you're interested in this, you would want to try it and see how your body behaves to it. Again, prescription, talk to your healthcare provider. Why on earth am I talking about neurohormones? Why am I talking about the brain so much? For people who say sexuality is in my genitals, what are you doing? Well, guess what? It's really in your head as well. So these are some MRI studies, and they look at regular people who have no problem with sexual desire or arousal. They were volunteers for this particular study. They were in an MRI machine, and they were shown a series of erotic images, like a sexy movie, and it showed that the blood flow came into their brain in areas that we know are responsible for sexual motivation and sexual arousal when they were presented with looking at erotic images. This is a normal blood flow pattern when one is feeling aroused. For people with low desire, also known as HSDD or hypoactive sexual desire disorder, they too were put in an MRI machine, and they too saw the same exact erotic images or sexy movies. And look at the difference in their blood flow patterns. Very, very low blood flow patterns to the brain. And this is associated with very low feelings of sexual desire, very low feelings of sexual arousal. I'm going to show you these again because it's really striking. So we're going to go back to normal controls. Look at these red areas. The brain lights up when it feels desire and arousal. This is normal control. And this is people with self-proclaimed low desire, absolutely low desire. They want, but they don't want. And so here, look at this. They have much less blood flow in the areas of the brain associated with sexual motivation and sexual arousal. So you know what? Sexuality is in the brain as much as it is in the genitals, if not more. Okay, let's look at some more options, shall we? Do you believe all the cool things that women can take or be exposed to help their sexuality? Alrighty, so some other things that aren't FDA approved are things like testosterone. I'm sure you've heard of testosterone supplementation before. Testosterone comes in creams and gels and patches, and it's certainly most of the testosterone products have been approved by the FDA, but not for women. They've been approved for men. And so if a woman takes testosterone supplementation, it's considered off-label or around the labeling. There are pellets that people have implanted in their buttocks or in their arms. And there's things like, I'm sure, well-known products, Viagra and Cialis and Levitra, also FDA approved for men or male-bodied people, but they can be used off-label for female-bodied people. Okay, so these are just some options. And again, we in the business, people who run sex med clinics, we use all of these things, generally speaking, but we are sure to tell the patient if something is off-label or on-label, prescription or non-prescription. Speaking of non-prescription, let's look at some more options that are non-prescription. There are over-the-counter hyaluronic acid-based lubricants and inserts like suppositories. A fun fact about hyaluronic acid, that's really not very acidy at all. But what it does do, wherever hyaluronic acid is placed on or in the body, it attracts 60 to 100 times its weight in water. So imagine putting a tiny little suppository in the vagina and watch what happens. If you have adequate water intake in your body, it's going to attract water or fluid to come into the vagina and really address vaginal dryness. In fact, hyaluronic acid products are so popular, they've actually been studied in what they call head-to-head trials, or a trial where the woman doesn't know what she's using. She has placebo or she has a different indication. And so what they've done is hyaluronic acid versus estrogen suppositories. Women didn't know what she was using. And actually the hyaluronic acid either equally performed estrogen or outperformed estrogen in terms of soothing dryness and making a woman feel really comfortable and moist in the genital area. It's hyaluronic acid. These are available over the counter and certainly on the internet. Restella is another supplement available from a company called Bonafide, but also available on the internet. It is a supplement that has been developed actually in Europe 20 years ago and had just come to America in more recent times, but it has been tested really, really quite rigorously. It is a combination of some amino acids and some vitamin C. Again, no hormones in this at all. And the end result is increased blood flow to the clitoris and the labia, making it more likely that a woman will have an orgasm, or making it more likely that her orgasm will be strong like it used to be in many cases. When we talk to postmenopausal women particularly, they'll say, yeah, I can have an orgasm, but it takes A, forever, and B, when it happens, it's like, boop, like not very impressive. And so Restella is a supplement, not a hormone and not a prescription product, that really helps people have orgasms when they either can't have them or they've lost the intense part of it. There's the newest kind of thing that hits the market is CBD and THC type suppositories, and also lubricants and moisturizers. Now, across the United States, CBD is legal no matter what state you live in. And so that is the one, living in Pennsylvania is the one that I particularly am interested in. CBD is the hemp portion, the non-hallucinogenic portion of the hemp plant. And they are used particularly for pain control. So CBD oils and suppositories are placed in the vagina for comfort, but also for relaxation, particularly relaxation of those muscles in the vagina that can be quite tense. And so these are just really lovely things. Whenever purchasing anything that is CBD in nature, it's really important to know what dispensary they're coming from and how the CBD is organically produced. Hopefully it is organically produced. So know your sources on things that aren't very well controlled. Let's go back for a minute. The hyaluronic acid-based products, generally speaking, have been looked at to be safe, even from Dietary and Nutrition and Cosmetic Act of America. The Restella has been produced by Bonafide, and that also has been presented to look at the American Drug Act, even though it's not a drug. They look at it for safety, just baseline safety of amino acids. But sometimes CBD can come from all different sources. So know your sources for CBD, or again, ask your healthcare provider if they endorse this, and if so, do they endorse a particular manufacturer? Just be sure you're using safe products. Okay, so I alluded to this a little bit. You know, the vagina and around the bladder and around the anus are surrounded by a beautiful myriad of muscles called the pelvic floor muscles. When they're acting properly, the pelvic floor muscles at a normal state, like you're sitting listening to me right now, your pelvic floor muscles are neither completely relaxed nor completely contracted. They're in what they call a tonic state, or they're actually just got perfect tone to keep you comfortable and to keep your bladder, your anus, and your vagina, if you own one, or your penis, if you own one, completely comfortable. Let's go, we're still talking about normal here. In a normal state, when you then want to go urinate, your pelvic floor muscles are relaxed and out would come out your pee. If you want to defecate, your pelvic floor muscles would relax, and with your help from pushing, you have a little bit of poop come out. And if you're going to have sexual play, your pelvic floor muscles are going to relax. And if you're a female-bodied person, they are going to relax to allow for potentially your own fingers or someone else's fingers, or a penis or a vibrator or a dilator or something like that. Okay. Let's pretend for a minute that for whatever reason, your pelvic floor muscles don't get the proper message to relax during those activities, but instead it stays really, really tight, and even spasms, or just stays in a really high tone, hypertonic state. That is a leading reason for people to have pain with penetration, pain with thrusting, to have pain with urination, or difficulty emptying their bladder all the way, or even constipation, having difficulty emptying their bowel. And so when those kind of things happen, the pelvic floor is too tight. And so we have specialists named pelvic floor physical therapists in the physical therapy domain that help women and men to relax their pelvic floor so that it can have normal function. We have a whole product line in America of dilators and vibrators that can help to stretch or relax that pelvic floor. And we also, as healthcare providers, we prescribe pelvic floor muscle relaxant suppositories and or those CBD suppositories I just talked about to help those muscles relax. So pelvic floor therapy and pelvic floor treatment is so important. And it's life-changing actually for people that have problems, again, with urination, defecation, or sexuality. This is life-changing to have the pelvic floor normalized and have the muscles working properly. So again, talk to your healthcare provider because we can get you a referral and get you right to the right people who know how to help. There's another device that's called the Millie. This is the first electronic dilator. The Millie is something it's a dilator that goes into the vagina about the size of my finger, very small. And then electronically, it's controlled by the person who's using it. Electronically, it expands once it's in the vagina and slowly stretches the vagina. This is particularly useful for people who haven't been sexually active in a very, very long time or ever, to see very slow and very comfortably to stretch the vaginal walls and to relax those muscles. It has a vibrating function as well, and so that it can be used for pleasure from vibration, but also vibration can warm the muscles and help them to stretch as well. So it's not always just for orgasm. Vibration is good for the muscles as well. It's good for blood flow. So this is called the Millie, and it's also available over the counter. Another really interesting device that's available over the counter is the vibrating vaginal wand. There are many different types. I just brought up the Amazon listing here for the Intimate Rose vibrating wand. This is a little S-shaped device, very, very thin, not even thinner than the Millie, very, very thin. And it is designed to have women or men who have tight pelvic floor muscles to be able to put a wand right at the inside on the tight muscle. And then in this case, this is a vibrating wand. Remember we said about vibrating is that vibration can warm the muscle and help it to relax. And so this is a device that often is used after a woman or a man has graduated from pelvic floor physical therapy with a therapist. They're home now and they want to be able to be sure that their muscles stay supple and don't go back to being spastic. And so they'll use this pelvic floor wand at home to do their own home rehab of their muscles. It's very tiny, it's very easy to use, and it's rechargeable. Also, the price point is not prohibitive. So this is a great device to have at home for the purpose of keeping those pelvic floor muscles not too tight. Well, things that also can happen at home from the beauty of having a computer in one's house is you can go to sex therapy right in your own living room or in your kitchen. You can go to cognitive behavioral therapy, which is with a traditional therapist, helps to understand what behaviors and thought processes one has when one is not feeling sexual or feels very uncomfortable about sexual topics and sexual issues and sexual behaviors. You can see a therapist, but you can even see them right online if you want to, and they can talk to you about any emotions you have or behaviors you have that really aren't serving you. And that's called cognitive behavioral therapy. It gently reshapes kind of how you're looking at the world, particularly looking at your sexual world, in order to adopt a more healthy habit. Sex therapy is actually kind of the same thing, but it doesn't really look so much at dysfunctional emotions, behaviors, and cognitions in general. It specifically looks at those issues as it relates to how you enact sexuality or don't, how you interact with your partner in the sexual space, and how you could better do that. And you can go to therapists. Absolutely. There's great therapists all over the United States. But what my patients really enjoy about kind of the loveliness of having computers is that you can now have therapy in the privacy of your own home. And that's really very, very nice. You know, a very famous person once said that when sex is good, it adds about 15 to 20% of additional value to a relationship. If you've got a great relationship and you have good sex in the relationship, it's like icing on, or cherry on the ice cream. It's like 15 to 20% even better because you have good sex in a good relationship. But when sex is bad or non-existent in a relationship, it robs the relationship inordinately of power, of spice, and of good feelings, goodwill back and forth. So bad sex, non-existent sex is much more devastating to a relationship than good sex is to add to a relationship. So that's just one good reason. If you have sexual issues or sexual concerns, let's do something about it, because there's plenty of help, as you can understand from this presentation tonight. In conclusion, sexual health is really important to a woman's quality of life, and female sexual disorders are incredibly prevalent. I showed you those stats. It's like you are not alone at all. Oh, but here's the issue. Only a third of women really seek care and talk to somebody about this other than their best friend. Again, nothing wrong with best friends, but that's not always going to be the source of knowledge. And so seek formal care if you'd like more information, and listen to podcasts and listen to things that have evidence-based information. Initiate a discussion with your provider. They want to hear it from you. They really do. And if for some reason they're not educated enough in this space, they will hopefully be able to get you referred to someone who is. And one more thing, list your questions before you go in. Whenever we start talking about intimacy and sexuality issue, people can get like flustered and they don't really know what words to use. If you list your questions, then the discussion is going to stay really focused, and you're going to get the most out of the discussion with your healthcare provider if you write down what it is that you'd like to talk about. And with that, thank you so much for your attention, and I look forward to some questions. Back to you, Jeff.
Great. Oh my gosh, Suze, that was so awesome. Thank you. And boy, if there was ever a question, is there anything for women? You just answered it. There's a whole...
It's so exciting though.
It is so exciting, because you think it wasn't that long ago we had very little out there, but we've come so far. If you have a question, you can put it in the chat, or you can ask those questions as well. So please feel free to do that as we move along. But I know your clinic, much like mine, you know, what's in our clinics, what we try to do, yes, we can hand you a prescription or we can recommend things, but we also try to sit down, really understand our clients and how they could integrate whatever the therapy is into their love play. What are their goals? What do they want to do? Can you talk a little bit about the approach to helping people with their sexual health issues?
Sure. So just like you said, it's really important to kind of get a background of how did we get to the space that you're in. And so we talk about, first of all, we make sure that the language that we're all using is the same language. So for instance, sometimes women will come in and they'll say, oh, I just don't have any libido at all. I don't know what happened to my libido. And I can get really, really aroused, but then the libido part isn't there. Well, if you can listen to that context, what they're really saying is they can't have an orgasm, but they're using the word libido as kind of a general term. And so one of the first things you do is really look at what kind of language is going to be expressing what the true problem is. And I always don't put words in the patient's mouth. It's really important to have a woman explain things to the best of her ability. And then what we do is we'll reflect back and say, what I'm hearing you say is, I think that you're either, again, having no desire. In this particular case, it was having difficulty having an orgasm or getting to the top of her arousal. So that's important. Another really important question is was sex ever, as you considered, normal? And if it was, what did that look like? How long ago was it? What was it like? Was it effortless? Was it with a different partner? Was it with yourself? When did things change? That's the third question, is what changed, and do they have any idea what caused whatever's going on right now? Sometimes women don't have desire, but it really has nothing to do with maybe their hormones or their neurohormones. It might have to do with their stress and anxiety. It might have to do with a dysfunctional relationship at home, or maybe a altered body image. So maybe something's changed in their body that has really, they just don't want to get naked with anybody for any reason. And so you see some of the things I talked about tonight, a pill isn't going to fix that, but good talk therapy, cognitive behavioral therapy, good sex therapy, that might really address those issues, those underlying issues. So remember, the beginning of my talk, the slide was how complicated women are, how we are a beautiful, beautiful mix of our biology, our backgrounds, our psychology, and our relationships, past and present. So really getting to that is so important. And that's probably that takes a lot longer when you go for a consult in my clinic than any part of the physical exam or the writing of the prescriptions. That's at the very end. The talking part is really, really important to figure out what's going on.
Absolutely. I had a resident who was sitting with me in clinic the other day, and he's like, we started talking about everything, and my client had some sexual trauma and some different things, and there were so many things to unpack and talk about. He was like, it's like you were in here for an hour and you just touched the tip of the iceberg. There's so many things. But I think you bring up a really good point, especially with libido. Sometimes people, when you start pulling it apart, they're like, some of them are like, no, I don't think about sex. It disappeared. But some of them are like, yeah, I think about it all the time. I don't have sex. I don't do anything about it. My libido's off. And you're like, your sexual thoughts are there. You see things, you're thinking about sex. Tell me a little bit more, right, about why you're not having sex. Well, like you said, women are brought up. I remember I can bring home the bacon, fry it up in a pan, and I can do everything, right? I can do everything, but we can't do everything. Foreplay, some of wonderful foreplay is, can you do the dishes? Help me do some things around the house so that I'm feeling a little more free to be sexual, right? There's so many fun things we get to work on with our clients, right? And it's so
the other thing is, like, sex is so much more than intercourse, so much more than intercourse. So even for people that are working on the dryness situation or the pain situation, you really need to kind of defocus. And I know you talked about this last week, but defocus from something in that vagina. Do you know what I mean? Like take that away for a minute, because part of the fun is, and honestly, I'm going to tell you a little trade secret, the listeners. We take sex off the table for people as a tool. Like Jeff and I both say, absolutely no traditional sexual play, including penis in vagina or vagina on vagina play. Like, no. You still want to be intimate with each other, but we actually dissuade that, so that that tunnel vision, and all of America shares it. If you think about that, it's not you guys, it's all of America. We think sex, but make it playful, make it fun, and connect with each other in ways that maybe you used to when you were dating, but you haven't since. Not at all.
Totally. And then, when they start exploring it, I had this patient who was like, wow, this is incredible. She was like, I got to a place where, with the different things I've been through, it is not comfortable. She said, the garage is closed. Nothing goes in there anymore into my vagina. It's not happening. But we did all these really creative things where she would put her thighs together, and he would have put his penis in there, rub across the clitoris as he had intercourse in her thighs rather than inside her vagina.
Outer course, as the
outer course, it's like, and outer course and love play, and they were like, this is amazing. So it's really interesting. You can broaden and open up your horizons, and it's pretty exciting and fun. So I think the work we get to do, that people let us in their very private worlds, is first of all amazing and brave. But then it's so rewarding, because when you get inside there and really understand everything with your patients, we can find a whole new world of intimacy and love. And it's a pretty cool thing.
Yeah.
Oh my gosh, you are such an amazing clinician. I love you dearly. You're an amazing human being. Thank you for the incredible information you provided this evening. I so appreciate it very much.
My pleasure. My
Um,
pleasure.
to end, as we always do, what we're going to do is you guys, there's so much great information tonight, and you can watch it over and over on YouTube or whatever your favorite social media place is. So it is a lot of information to process. All right, let's finish like I like to finish. You know how I like to do this. And so
I
if you were
do.
on the last episode, get yourself comfortable. You can sit with your feet flat on the floor. You can lay down, whatever is comfortable. Get your hands in a comfortable position. Get comfy. We're going to breathe together. Breathe into this new knowledge with me this evening. I want you to take 4 to 5 counts to breathe in and 4 to 5 counts to breathe out. I want you to continue 4 to 5 counts in, pulling deep from in the abdomen and lungs and filling your lungs completely, and 4 or 5 counts to exhale. And as you exhale, feel all your muscles relax. Let go of any tension and just melt into the chair or the bed or wherever you're getting comfortable. Relax and breathe. Keep going as you listen to these words. You, my friend, are a unique, one-of-a-kind, divine being. Yet what's so amazing is you are deeply and intricately connected to everyone and everything in this miraculous world. As you breathe in all the fresh newness in the world and you exhale all the negativity out, relax completely and know that you truly can feel and be healthier and better. And know that you, my friend, you are enough. You are inherently enough. Next week, we are going to be talking about some other things. So I would like to thank you before we go out with here's our little plug for next week. And so thank you, Lori, so much for joining us. She said amazing presentation because you are amazing, Dr. Kellogg-Spadt. I love it. And so next week, this is what we're going to be talking about very quickly, and then we will say
In this episode of Dr. Jeff Talks About Sex and Intimacy, Dr. Jeff dives into the topic of male sexual health. Jeff offers a candid and evidence-based exploration of the challenges, myths, and solutions surrounding men's sexual well-being. From understanding the physical and psychological factors affecting performance and desire to addressing common conditions like erectile dysfunction, this episode provides practical insights and guidance for men and their partners. Whether you're seeking answers for yourself or looking to support a loved one, Dr. Jeff's expert perspective will empower you to approach male sexual health with knowledge and confidence. Join us next week on Dr. Jeff Talks About Sex and Intimacy.
So, don't forget, Uronurse is for any nurse professionals or anyone interested in learning more about urology, and Uropatient is for Uropatients. Those are two of Vic's other podcasts, and I can't thank Vic enough. Isn't he amazing, Susan? He just lets everything roll. He's just seamless, and he is a one-person production company. So thank you so much for joining us this evening, and thank you, Susan. Thank you, Vic, and thank you most of all to all of you who are watching us now, who watched us live or are watching us on the recording. Have a blessed one.
Thank you.